Republicans control the White House, they control the Senate, they control the House. And in the past, Democrats, when Republicans have tried to do something like this, Democrats have argued that the norms of our government should be that you negotiate policy outside of a government shutdown. I mean, I have over many years covering Washington, people have said that over and over and over again. And now I have neighbors in the D.C. area who are both employed by the federal government who are having to use food banks. We are heading into Thanksgiving. Why is it suddenly right to do it this way and to do it for this long when it didn't used to be the right way in Democrats' view?
Oh, that's an easy answer. It's Donald Trump. You're talking about norms in the time of Donald Trump. It's also normal now for you to tear down the East Wing. But Democrats have spent so much time arguing about how maintaining those norms is actually incredibly important in the face of Donald Trump. It's all out the window. It's all out the window, Casey. No, when you're dealing in the time of Donald Trump, this is the man that is like extorting people. He's literally, breaking every rules. We're not going to go back and play by the norms when we know that what's on the line. What's on the line is 24 million people are going to have their insurance rates premiums doubled. That's a new thing, by the way. And the fact is the president and everyone expects us to play by these old norms.
Didn't Democrats kind of set that up in the bill that you passed, though, that these subsidies were going to expire?
When we passed the bills and back in the day as part of the Inflation Reduction Act, of course, we were trying to, maybe hope for the best that this country and our Republican colleagues would understand that raising insurance rates on people is a bad thing. I'm sorry they don't see it that way, but it's also not my job to make their job easier. My job is to make sure that the premiums of 24 million Americans does not double overnight. And if it makes it harder on the Republicans that we're putting them in a very difficult position that they have to answer for that, and hopefully it actually comes with a good outcome, which is Americans not having to pay higher premiums, then that's good. But I'm not going to abide by old norms, especially when you're dealing with this presidency, this administration, and how the Republicans themselves have been acting.
So this is a serious indication of the breakdown of the process. But one of the existential fights here, beneath the surface, but really important to Americans, is the cost of health care. I mean, it has been rising way faster than inflation. It's a killer for small businesses that really have benefited by the Obamacare tax credits. They've been able to afford to continue to provide health care for the workers who they really value. So I'm with you on the overall critique of shutdown as a tactic. It really is not something that's desirable.
You can vote.
But there is a real issue about health care.
You're always reasonable when you come on, and I've said I've said that. And you're almost conceding that you should not be shutting down the government, that the Democrats should not be doing that. And I don't think you'd ever say that extortion is the way that Republicans should get their way if they don't like the IRA or they don't like overspending or whatever it is at any given point in time where the other party has a disagreement. This is not the way to do it. As far as Obamacare, you probably realize a lot of these premium increases are just built into Obamacare. The expiration of the pandemic subsidies is only a very small part of the increases. So that discussion has to be had about fixes to Obamacare so it doesn't keep spiraling, the costs don't keep spiraling. But you're not going to do that before we reopen the government. It's not going to happen. It's going to have to happen afterwards. Are you ready to vote with the Republicans to reopen the government at this point as a reasonable Democrat? Maybe others would follow you.
I'm not there yet because we have had literally, Joe, no discussion whatsoever about how we're going to deal with these spikes in premiums.
This is the right way to do it, Senator? By people not getting paychecks at the TSA? This is extortion. You think this is the right way to do it? In your conscience, you think it's the right way to do it? I never thought I'd say that, Andrew, that as a human being, he always says that. As a human being, you think this is the right thing to do? That's your line.
Well, that's why Senator Hawley on Have Our Bill to make sure that folks get the nutrition that they absolutely need is why the president is paying the troops. But there is something that we've all got to acknowledge here, okay? The administration has had an attack on health care, as we know it. The Medicaid cuts were immense. They're going to have real impacts on individuals, and they're going to have impacts on state budgets and community hospitals. The loss of the premium tax credits is going to mean that folks are going to drop health care. I mentioned in Vermont, it goes from like $900 for some folks a month to $3,200 a month. That's totally
Senator,
unsustainable.
from $900 to $3,200 a month is not because of the tax subsidies alone. The Journal points out that the tax subsidies, these extended tax cut subsidies, are only responsible for about the expiration of those are only responsible for about 3% of the increase. That's peanuts. You still have a huge problem. You still have a lot of people who aren't going to be able to afford health care.
Well, first of all, I want to acknowledge you're right about that. I think it's much more than 3%, but the cost of health care. And if we're sitting down and talking, there's a number of Republican ideas about how to bring down the cost of health care other than by throwing people off of health care insurance. And if both sides were willing to face this, there'd be some acknowledgement that we've got to do something about PBMs. We've got to do something about prescription drug pricing power. We've got to do something about excessive utilization. So the real conversation should be about how do you make healthcare accessible by making it more affordable.
Yes.
And the approach that we've been taking so far is to throw people off of Medicaid and now throw people off of Obamacare.
Would you agree with
you're
the idea
hearing my
that
frustration.
I hear you, and I hear
ahead.
your frustration on this.